We're not going to enforce our way out of this. And Alberta has done it extremely well on a global scale by taking a lighter approach to restrictions than many other jurisdictions that had vast lockdowns and aggressive enforcement and micromanaging people's lives. Many of those jurisdictions have seen much higher levels of infections and fatalities than Alberta has. And I want, as much as humanly possible, us to maintain our approach, which is focused on people exercising personal responsibility. Because, as Dr. Hinshaw has pointed out, and as have I, for every public health restriction, there are negative and sometimes devastating broader social, economic, and health consequences. I think in the COVID debate, there have been some narrowly and kind of myopically focused only on limiting the spread. We have to look at all of the other considerations. Stats Can reported in the second quarter of this year an estimate of 450, what they called, quotes, excess deaths above and beyond the average number for that period of the year. We're doing a deep dive into figuring out what is the cause of those. Are they related to delayed surgeries? Are they related to people who didn't come to hospital because of COVID fear or COVID restrictions? We've been tracking very closely non-COVID related health data. Thankfully, we have not seen an increase in suicides for the first 6 months of the COVID period in Alberta, but that there may be a delayed action in terms of the mental health impact. We've certainly seen a catastrophic result in opiate overdose deaths, with over 400 Albertans this year having passed away from opioid overdoses versus under 300 COVID-related deaths. So we are focused on the health of the broader health, physical, mental, social, and economic, and that's why our focus, as much as possible, will continue to be on encouraging people to exercise responsibility rather than micromanaging their lives.